Rahul Chaubey, sir, are you around?
Your co-host now.
Okay, thank you. Yeah, will do. This is what my yeah. Good evening. A very warm welcome to all listeners of PhysioTV as we embark on this very special journey today called The Road Less Traveled. It's basically going to be an interview series with distinguished, eminent, and groundbreaking physiotherapists. And hopefully, their journey will kind of lead us, younger therapists, and the world over, whoever's listening to us, to embark on our own journey, which will take us in different paths and, help us reach those heights. So today we start our first journey, or rather, we start our journey with the first speaker, Dr. Kiran Challagundla. I am sure he needs no introduction in our profession as well as in Indian badminton. He's associated with Indian badminton very closely now. He has been the physiotherapist with the Indian badminton team since 2009 and also associated with the Gopichand Academy in Hyderabad. He's a certified yoga instructor as with special interest in sports physiotherapy and manual therapy. He's a certified NDS instructor and has been teaching neurodynamics solutions in India as well as other countries and universities in Asia since 2007. He is the director and course instructor for Maitland's Foundation for Sports and Manual Therapy. He graduated from Manipal College of Allied Health Sciences and then traveled to Adelaide in South Australia for his master's in University of South Australia in 2005. He has also worked with the eminent physiotherapist Dr. Michael Shacklock, who is certified as the founder of Neurodynamics Solutions before returning to India in, I guess, 2006 or 7. He has been a physiotherapist for various sports teams and is currently the head physiotherapist for the Indian badminton team, with whom he has been associated for the Asian Games, the Commonwealth Game, as well as the very famous Olympics of 2012 and 2016. He has worked closely with Saina Nehwal for many years, including the London Olympics in 2012, and is working with the current badminton sensation PV Sindhu ever since she was a junior player of 13 years in the academy. He has been credited to be a crucial member of Team Sindhu along with her coach during her journey for the Olympic silver in her 2016. He has also been a physiotherapist for Deccan Chargers cricket team for IPL, the Hyderabad Heroes cricket team for ICL, the Hyderabad State Cricket Board, Premier Badminton League teams, as well as a football club in Adelaide in Australia. He was awarded the Distinguished Alumni Award from the Manipal College of Allied Health Science and Manipal University in 2008. So let me start this session, this interview with Dr. Kiran. Welcome, Dr. Kiran. It's really a very pleasure. I think you'll have to unmute yourself. Yeah.
Hi, yeah, hi. Hello, everyone, and hello, ma'am. Thank
Yeah.
you
So,
for inviting me for this interview, and it's been a great pleasure joining all you guys.
yeah. So basically, we would like to kind of, start from the very beginning, as they say. So let us know a little bit about how your journey into physiotherapy started.
Okay, ma'am. Yeah, because as usual with after plus two or else intermediate or else plus two, whichever it is, usually many of the guys who are in the medical field, realistically speaking, the first preference would be to try for MBBS. So even after my plus two, when I've given the entrance exam, I've tried for the MBBS. So I lost by around, I guess, 12 or 13 ranks, statewide ranks. So at that time, there was this option for me, two options about, not to accept MBBS, I could have taken any other choice. So usually, most commonly, it was like either start with dental, then pharmacy, and then what you say, this veterinary science and this thing. But usually, but somehow I was more into, I like more into interacting with people and something which involves more of exercises usually. So at
Mhm.
that time, I've seen this advertisement about Manipal University, and when I've applied for the Manipal University, I've got the admission. So my first thing at that time, the first impression about physiotherapist at that time was obviously whenever we keep on watching cricket matches and everything, we used to say at that time, I still remember any Indian team cricketer gets injured, Ali Irani sir, he used to run to the field and he used to do some treatment and go. So I used to think that, okay, that is something physio. So that was the basic idea which I had about physio. And straight away when MBBS was not possible for me, the first choice when among all the other choice, when me and my family members discussed for few couple of days like that, so physio was something which I felt like the profession which I could enjoy for the rest of my life, because it's not something usually uh, I mean, as I've said, after MBBS, usually it was BDS or pharmacy, many other things. But I felt like profession which I should choose some profession which I could enjoy for the rest of my life.
I
Sort of.
heard you were also into sports very actively. I mean, that's what kind of pushed you towards physiotherapy.
Yes, ma'am. I was also like right from almost from the school, almost from the school days. I was very active into sports, especially kabaddi, volleyball, and cricket. These three used to, because I was one of the tallest guys in the class. So even basketball and volleyball used to be like in even though I didn't have any idea about sport, how to play, I was literally pushed into the teams like that. So school days
Okay.
and college days, I really used to enjoy playing sports a lot. So that was something which has made me like, okay, I enjoyed sports. And then physiotherapy means my basic idea was like, yeah, we could do something sports, or else in fact not just sports, I would say active life. So something like active life and interacting with the people, which I felt like, yes, this is the profession which I could enjoy for the rest of my career, like that. For the rest of my life, so I've chosen the profession. And that too, I've got admission in Manipal University. I guess at that time, this was in 1997. I guess at that time, Manipal University is, I guess, one of the top five universities in India, actually. And also, not
That's
only in
true.
India, one of the world's renowned. So that's how I've got into the physio profession.
Okay, that's great. I mean, looking at Dr. Kiran, you will not guess that he used to love interacting, because if anyone remembers, he used to be this very quiet, you know, not really spoken, at least amongst we never knew him to be a very talkative person. And even today, in case he takes his neurodynamic solution classes on instructor as an instructor throughout India and abroad, you will know him as a very soft spoken and modest person, very unassuming. So it's very difficult to believe that you used to love interaction. So anyways, so you kind of spent your, I guess, 4.5 years in Manipal. So I
Yes.
guess that must have helped you to establish a little base in physiotherapy before you thought about, going ahead with anything else.
Yeah. Actually, in fact, I mean, there was couple of things which happened. Couple of things in the sense. So my main thought of getting into physio profession was, as we could see in the television, say sports physios coming onto the field and then uh, doing treatment, that sort of thing. So that really attracted me to get into physio profession. But when I've started my academics or education, actually I was very much inclined, or else I was very much attracted towards neurophysio, especially
Yeah, I
strokes and
heard that.
hemiplegic patients. In
Exactly.
fact, when we used to get posted, actually, when we used to get posted in the postings in the third year of undergraduation, like that, usually our clinical postings used to finish by 4 p.m. But I used to say quite a few days, I used to stay in the wards till 5, 5:30, 6 p.m. like that. And I used to treat lots of hemiplegic patients. So that was from sports. Suddenly I got attracted second year, third year, fourth year undergraduation. I was really attracted towards neuro to especially the stroke and hemiplegic patients. I used to do a lot of extra studies on that and treat the patients and all those. But after my studies, again, things change actually. Once I finished this one, once I finished what is my undergraduation studies, then again I got opportunity, the first opportunity, hardly in a week's time, I got opportunity to work with Hyderabad state cricket team.
Oh, okay.
So till that time, it was more or less like, after my undergraduation, it was more or less like, if I get a chance, neurophysio, let me try to be, especially neuro in the sense, especially stroke and hemiplegic patients. Sort
Wow.
of.
So there was a major turn during the graduation, and
Yes,
again you came back to your roots, I should
yeah,
say, towards
I get
sports.
back to the roots. Especially the main thing is, of course, because I mean, I'm someone who from the beginning when I was treating patients like that, I'm someone who tried to look for quick results.
Okay.
Why sports really attracted was we used to treat something and straight away results. So hemiplegics and those was like, it was more or less like we need to do treatments for weeks or months together. That's why actually whenever I meet any pediatric physios or else physios working with spinal cords and strokes and hemiplegics, I really appreciate them because their job is much more difficult and much more long lasting, which involves a lot of patients than what you say my profession. But
Oh, agree.
as we can say, the sports, again, as I've said, I mean, as I can say, this is again into two areas. One is quick treatments or else treating the injuries, versus second is building a player. So here also
Hmm.
there is long-term thing where building a player, usually it takes us few years of work and everything. So that's how generally it's like, from neuro I was shifted to sports physio
So how
profession.
long were you associated with the Hyderabad cricket team? I mean, the
Cricket team, 2001 I finished my undergraduation. So I
Mhm.
was there for almost 2 years with Hyderabad cricket team. And then I
Okay.
got opportunity to work with, to go to Australia.
Hmm.
Because in fact, after my undergraduation, after 1 year of experience with Hyderabad state cricket team, I got opportunity to go for post-graduation in University of
Okay.
South Australia. But still I've
Hmm.
taken extra 1 year because I wanted to be very clear that, I mean, the admission I got was in Masters in Orthopaedic Sports and Manual Physio. So before I joined in PG, I wanted to be very sure that, yes, sports physio, whether I should be in sports physio or else neuro physio. Even though during that 1 year
Oh,
time,
wow.
when I was working as sports
Still.
physio, I still used to go to hospitals evening. We used to have 2-3 hours of extra timings in the evenings. So I still used to work in hemiplegic, especially neuro, that too, especially stroke and hemiplegic patients. So I took extra 1 year after my undergraduation to make sure that which branch of physio I should select, whether it should be the sports or else whether it should be neuro. So after a lot of these things, after my experience for almost 2 years with the sports team, then I've realized that, yeah, sports physio career is something which I could cherish for the rest of my life, sort of.
In fact, I guess this trend is seen the world over. You know, people do take clinical experience after their graduation to kind of know what their inclination is towards. Whereas, I mean, I do advise this to many students of mine, but usually what the trend is in India is as soon as the graduation is over, people want to plunge into the, post graduation, just thinking, okay, maybe I'm interested in, musculoskeletal, maybe I'm interested in neuro. So it always gives you a better perspective when you have about 1 or 2 years of clinical experience to really know what you're rooting towards.
Yes,
And
yes,
that kind of clears your things, as you said, no? You took that one extra year to kind of clear your perspective.
yes, yes.
So, so why Australia? Why not US? Why not UK? I mean,
Yeah, I mean, so
or why not India?
yeah, because I mean, at that time, actually speaking, generally during my undergraduation studies, I was never a brilliant student. It was more like 60% usually. 60% is the first class. I mean, if we get
Hmm.
60%, we used to get first grade or first class. So I just used to get around 61, 62% sort of thing. So then during my post, I mean, when I was working, as I said, when I was working as sports physio, for the Hyderabad state cricket team, yes, the players and the association really appreciated my work. But as a physio, I knew that I was lacking the knowledge. So it was like, yes, 60% knowledge. I mean, generally, if we say during for my BPT, if I got 61, 62%, I thought that, yeah, 60% knowledge may not be sufficient. Especially it's because, see, what happens is when we look at this physio, it's not just about whether you're working or not. It's something like patients or else people are, what you say, they're surrendering their, what you say, their life to us, believing us
Exactly.
that, yes, I'm trusting you. I will do whatever you want, make me a better person, or else give me a better quality of life. So that's something which I have said. In fact, it was like when I was treating the players also, players used to appreciate my work, but I was like, yes, if I do something wrong, maybe 6 months might go because of any major injury. So one
Mhm.
small glitch in the knowledge of me might affect months or years of career of someone else. So that really made me about then, yeah, undergraduation, I just tried to manage, what you say, clear the exams I tried to manage. So I thought that post graduation, it's almost like, let me study in the best university. Yes, it
Okay.
was almost like, yeah, I mean, I've got opportunity in US, okay, but my plan right from the beginning was after undergraduation to come back to India and settle here. So
Hmm.
my thought was, yeah, when this aim is to settle back in India, let me try to get, or else let me do post graduation in the best university. And the
Hmm.
University of South Australia, why I liked was because at that time in all other universities, the
Hmm.
post graduation elective area used to be only one, either masters in sports, or else
Hmm.
masters in manual therapy, or else masters in musculoskeletal. But this PG program involved all three: masters in orthopedic, sports, and manual therapy. So
Hmm.
that's why I was attracted more towards it. And this was also like, what you say, uh, Professor Maitland, actually. Professor Maitland is one of the, what's a full-time teachers or else
Yes.
professors there. And then Mark Jones, Mary Magary, Patricia Trott, all these people were used to be, what you say, the professors or else full-time teachers at that time. So I thought that, yeah, that is the area where if I go, at least I would gain the knowledge. So, and
Hmm.
knowledge might give me a career later, instead of going to abroad just for the sake of finding a career. And my decision at that time was, let me go to, or else select the university which gives me good knowledge, and knowledge obviously will give me the career for the rest of my thing. So that has made me select the University of South Australia at that time.
So it was a 1 year or a 2 year course?
2 year full-time
All
course
right.
actually.
So how was your experience? I guess he's one of your teachers here. I think
Yeah,
that's Mark Jones.
yeah,
Yes, Dr. Mark Jones.
because it was like, and yeah, I mean, obviously, whenever anyone goes abroad, we would see I mean, I'll not say the difference. It's just different ways of approaching the stuff. Usually, it was like there. The first thing was, the first lectures was, all the staff used to advise us to call them by their first name. There is
Okay.
nothing like ma'am or sir used to call by first name like that. So that was like, that was a major, what you say, um, change of the culture whichever I've gone there. But it was really good because one thing which I I mean, which really helped me was during the post graduation, or else or else during the study was anything we do with the patients or any question we ask or any answer we ask, always the question used to the staff question used to be, why did you answer that question? It
Why
was
did
like,
you ask the question?
yeah, suppose if for example, I'll give one small thing is like a patient came to us with shoulder pain.
Hmm.
I'll ask the patient age.
Hmm.
The straight away question was, so if it is a 25-year-old with same shoulder pain, same condition, how would your thought be?
Hmm.
If it is a 60-year-old with same condition, same intensity of pain, how would your thought be? So everything used to be, why did you ask that question? And if the patient or else if the client answers in a different way, what is your way of thinking? So
So
it
a
was,
lot of emphasis on, I think, clinical reasoning.
yes, ma'am. Lot of reasoning, less emphasis on the anatomy part. Anatomy in the sense, less emphasis on the textbook part, but it was more like approaching the patient. I mean, in basic, what I've realized was having knowledge is definitely needed, but the post graduation really made me stress on having presence of mind at that time. See, it's like we can have extraordinary, what we can say is like, I mean, during the exams, I guess we would be, some of the students might be experiencing this. See, one day before the exam, you can recollect everything. But in the exam, suddenly you might forget. So
Yeah,
having
right.
the knowledge is different from presence of mind. In that situation, you need to recollect. Then only you will get
Exactly.
good marks. So that is something what it was like. Gaining knowledge is different, but the presence of mind, when you are with the patient, try to be very active and very alert with the presence of mind. So that's something which has really pushed me during my post
I
graduation.
think he calls it also thinking on your feet. Because
Yes,
I had the good fortune of attending a 3-day clinical reasoning workshop for neck and shoulder pain with Dr. Mark Jones. So he
yes,
had come down to Bombay for conducting that course.
yes,
So he used to keep telling that at each point of your evaluation, you are already forming kind of a little diagnosis, right from,
yes,
as you said, the age of the patient, the this thing, you already have some things in your head. And with each evaluation, you're you're putting more weight towards one, and you
yes,
kind of root towards that diagnosis, and you kind of then, have a treatment plan for your patient. I
yes,
guess,
yes.
yeah. So, yeah, after uni, sir, what? I mean, after you passed out in, I think, 2005, if I'm not mistaken.
2005, yeah, I've done with in University of South Australia. I've done my masters, finished in 2005, and then I mean, my immediate plan was straight away to come back to India because it was
Right.
almost like stay for a couple of months, 3 to 6 months there, and then come back. Usually, that was the main thing. But luckily, I got chance to work in Michael Shacklock's clinic.
Yeah.
Michael Shacklock, those who don't know, he's founder for neurodynamic solutions. So luckily, I had chance to work in Michael Shacklock's clinic for 3 months. So
Oh, okay.
at that time, when I was seeing him doing, I mean, obviously we would be thinking that, yes, I've done my master's in University of South Australia, one of the best sorrels. So I'm done with my knowledge. Everything is there inside, sort of thing. Usually used to be the impression. But when I was working in his clinic, he was doing something different actually.
Hmm.
So then when I asked him, then he gave me this thing, like he suggested like, there is not, I mean, there is no point in me trying to explain because when he was when he was doing some different techniques which I was unaware at that time, I was asking about why did you do this on the patients. He used to give some answers, but he said like, Kiran, best option would be you stay for another 1.5 year. I would teach you the whole concept, because he said
Hmm.
like, learning couple of techniques doesn't make much of, I mean, it might make you a better physio, but the long term option would be to have to learn the whole concept. So
Hmm.
my plan of staying there after University of South Australia, staying for 3 to 6 months, it got extended to staying in Australia for almost 2 years actually.
Oh, wow.
So at
Okay.
that time, I used to work half day work and then half day learning these neurodynamic solutions. And so
Hmm.
that way, from sports physio point of view, so again, that's what always I used to say that even during my undergraduation, my in physio, my association with sports physio and also with neuro was always there. even though I was trying to be sports physio, neuro always tried to come to me. Either I was going to neuro aspect or else neuro physio coming to me, whatever it is. So now actually that's what I'm very happy with this thing, because with my current situation, because even though I working as sports physio, I'm still in touch with the neuro physio through neurodynamic solutions teaching,
Exactly.
which was actually one of my, what you say, most liked area during my undergraduation period for a couple of years. So
Okay.
that's how after this.
Yeah, I know.
So again, after almost like 2 years in Australia, close to 2 years, I came back. Then again worked here for, because the course instructor, being a course instructor, it's not like straightforward one. It's like learning under Michael Shacklock for 1 year and then some experience and then having quite a few exams like that. So finally in 2008, I'd become official neurodynamic, international neurodynamic course instructor for Asia region. So that's how it happened, from here sports physio to neuro and then to neuro to sports. Finally, now I'm associated, happy to be associated with both sports and also with neuro physio actually.
Yeah, I heard you are also trained in yoga as a yoga instructor. So
Yes,
when did this happen? During your graduation or post graduation?
yeah,
I
itself.
mean,
Actually, I got, because my, at that time, because my parents are also into yoga since very childhood actually. So
mm-hmm,
I was into yoga thing, doing physical yoga and everything, physical yoga since childhood.
mm-hmm,
But my, after my, in 2007, I guess, yeah, when I was back to India in 2007, my initial thing was still I wanted to have some sort of association with yoga. So at
mm-hmm,
that time, I've seen this Srinivas Patanjali Yoga Institute here in Hyderabad. It was a
mm-hmm.
7 week full time, I mean, not full time, sorry, 7 week course daily for about 3 hours of this thing. My
Oh,
main
wow.
aim of getting into yoga was, one, to get associated with yoga generally, because Indians
Mm-hmm.
yoga, I always have the impression that yoga means Indian. So even though it's physio profession, I'll not say westernized, but at that time physio profession usually used to be the western sort of profession. So I always try
Mm.
to think that can I get yoga into physio, especially with sports
So
and
have
everything.
you incorporated? So have
Yeah,
you incorporated it?
yes,
And do you feel people who want to go into sports should also get a little
yes.
experience in yoga?
Yeah, especially even in our academy, if at all you can say, during the last year COVID lockdown period,
Mm-hmm.
we had online classes for almost 5 to 6 months. At
Mm-hmm.
that time, I used to take yoga session, only yoga session. I said
Oh,
there are some other physios who can take physio part. There are trainers who can take trainer part. So I used to take only the yoga session. So daily,
oh.
not weekly 3 sessions for about weekly 3 sessions for about 20 to 30 minutes each session. So I used to even take. So now what we have done is we have introduced yoga even to juniors. It's like
Oh, okay.
8 years. From 8 years onwards, we have introduced yoga for that one.
Okay.
No need of someone learning huge depth into that. Just getting, our aim was to get all the sports people get associated or else get introduced to the yoga field.
And why
I've
not?
seen,
I mean, yes, because
yes,
there's a wealth of, I guess even I have dwelled into yoga somewhat. We have an Iyengar Yoga Institute in Pune.
yes,
So I have been a student off and on
yes,
and tried to be regular with it. And I do feel that it does make a difference,
yes,
compared
yes,
to the usual exercises, general exercises, which are a more Western concept. I
yes,
guess we should try to make use of this wealth of Indian knowledge about exercise, and it does have its benefits. I mean, it's slowly, not slowly, I guess it has become very popular the world over, and especially now in the pandemic with the need for inner engineering, as you would call it.
yes,
I
yes,
guess yoga plays a big role in that. So
yes,
I'm very glad to know that you are also being associated with it. So now,
yeah.
when you return to India after the Australia experience, I
Yeah.
mean, what was your first thing that you took up here?
Yeah, I mean, so I've done this yoga training for almost for 7 weeks. It was a 7 week course.
Mm-hmm.
After that, initially I joined in one hospital, in a clinic sort of thing, in a
Mm-hmm.
clinic for 3 to 6 months.
Mm-hmm.
It was like doing for 3 to 6 months. So I worked for almost 4 months. Then I got chance into Indian Cricket League. I mean, in fact, the thing was like, uh, so I was looking for opportunity how I can get into sports.
Mm-hmm.
But once I came back, I mean, my general thing at that time was not to straight away rush into a job. It was like, let me take 5-6 months and let me find a good opportunity. At that time, I've done this yoga thing, and then I've also done this in a clinic, working as a physio sort of thing. And then the first major chance I got was to work in Indian Cricket League. At that time, it was the first 20 T20 league started by ZTV Group, which was mainly
Exactly.
planned by Kapil Dev sir and Kiran More sir at that time.
Right,
I
right,
got
right.
chance to work that too because before I went to Australia, I already worked with Hyderabad State Cricket team. So through that background, they've given me the opportunity. So I worked in the first season with that Indian Cricket League for the
ICL,
Hyderabad
yeah.
team.
The Indian Cricket League,
Yes,
League, as
yes,
it was called. Yeah,
ICL. And then in 2008, the first season IPL Deccan Chargers straight away
exactly.
got the opportunity. So I worked for in 2008 for Deccan Chargers thing.
In
So
fact, as a sports physio, I think you've been associated in your initial years with a lot of cricketers
yes,
rather than badminton players. And then the slow shift came. Yeah.
yes. And then so after that first year, I mean, in fact, this was a bit different because when I was in Australia, also I was working with footy. We say it's like Australian Football League. So I was also working in the football league teams, but there I worked in amateur league. It was not professional league, which means the difference is all the players, whoever are with the clubs, they have their own jobs. Daily evening for 2 to 3 hours, they used to play. But I feel that's where I've gained significant knowledge because what happens is that any injury, they just don't want to get investigations done because it was not their
Oh,
sports was
okay.
not their full-time profession. They're playing sports for fun and competing in the amateur league actually. Whoever is the topmost amateur league would get what you say would get promoted to the professional league in that way. So that's how there it really made me use the brains a lot because any investigations they would say no Kiran, you try to do something but I don't want to go to MRIs. And I guess all of you know how expensive the investigations would be in Western country.
Yes.
So that
Yes.
was really made me think a lot and do a lot of clinical reasoning, which made me it's almost like what you say whatever I've studied in the universities, I was lucky enough to apply those fully immediately. So I could say it was almost what you say. Anyone comes with shoulder injury, getting an MRI is the easiest part to find the injury. But doing all the tests and doing all the clinical reasoning, differential diagnosis, and trying to get to the conclusion, and as I always say, whether what we have thought is correct or not, the improvement of the patient would decide that one. So
Exactly.
and in fact, I would also say all these are like amateur players. You try to teach them strengthening, they would not say no. Do something. I would just lie down, do something. So that made me really get into manual therapy with no investigations, lot of thought or else lot of reasoning going into what you say into the assessment and then diagnosis part. So that made my thing tough job, but at the same time, I felt so. That's what I would say. I mean, anyone asked me advice, general, what I would say is getting the most difficult job in the initial stages of the career is always the best part. It might not be so what you say encouraging at the initial stages, but who knows? At least that helped me a lot. That's what something I could say. Yes.
Okay, great. I think these are some pictures of your ICL. And I guess, yeah, now I think we'll steer towards your Gopichand Academy and badminton days.
Yes, ma'am.
So tell us about how did you come to be associated with the Gopichand Academy and
Yes.
then with Indian badminton?
Yeah, so it was almost like so after the first year IPL with the Deccan
Yeah.
Chargers 2008 season was done. So I immediately got the opportunity to work with the Indian badminton team.
Hmm.
And straight away I've taken that opportunity because when I've talked with Gopi Chan sir, actually I really liked his way because he just then Gopi Chan sir he retired actually just one or two few years before that one. He was still very young at that time.
Hmm.
And when we discussed a bit about I mean because my general plan was when I've thought about badminton where it should be like Gopi Chan sir always had a vision
Hmm.
today where we are because he always works in a specific and clear cut vision. That's what actually makes him a great person because suppose at that time it was we are in 2008.
Hmm.
So by 2010, there is Commonwealth and Asian Games, and
Hmm.
2012 Olympic Games. So
Hmm.
he gave me a route map, or else roadmap about what we are trying to do for the next 2 years.
Hmm. Hmm.
So indirectly, I guess it's almost like I've committed to be with badminton team till 2012. So
Hmm.
the aim was Indians have never won any medal in the Olympics.
Exactly.
Let's try our part. And
In
also,
fact, it was in the nascent stage. I would say badminton was not really, there were not many of our players in the elite league,
yes, ma'am, yeah,
And suddenly, with this advent of Gopichand Academy, we found these players, we came to know names, of
yes,
people who are getting into super series and, the other badminton tournaments, slowly into Commonwealth, winning medals.
yes, yes.
So, yeah, I guess y'all have been very instrumental in making badminton, a part of, I mean, Indians a part of the elite badminton club, you would say.
Yes, ma'am. Because in fact, even it was like in 2008 Olympics also, Saina Nehwal, she played quarterfinals. So
Hmm.
she got some name. But again, as we have seen, Gopichand sir, he himself has undergone 5 knee surgeries during his career.
Yes.
So he realized realized the importance of a physio.
Hmm.
So we have got to that. It was almost stage by stage. It was almost like initially, let us perform in the Commonwealth Games. After
Hmm.
that, let us get at least one medal in the Olympics.
Hmm.
Once Olympics was done, then Gopichand sir's always aim was, now we have made a player. Next is make a system. System would produce players. See,
Hmm.
making one player is different, but creating a system where the system would produce players. So from there, actually, if you can see, and that's what I was saying, it's almost like making a player and making a system would almost take almost 6 to 10 years, or else a decade to make a system actually, which actually was like the great vision or else idea of Gopichand sir actually. And we can see now, if you can see, it's like almost because in 2008, 2009 when I've started, an Indian badminton player reaching a quarterfinals in a tournament used to be a great thing.
Exactly.
And now, if we are saying any player doesn't reach finals, we are getting it as a disappointing tournament sort of thing. So that's
Exactly.
the sort of the barrier which we have increased, which Indian badminton has come to straight away, we can say in this way. So really
I think
happy.
it's come of age. Yeah.
Yes,
It's
yes,
come of age, I would say. So
yes,
these are, I think, some pictures of the Commonwealth Games, if I'm not mistaken.
yes. No, 2008 Commonwealth,
In
2000.
fact, most of the players are with medals. I mean, in case you see here in the background.
Yes. I guess this is the first time Indian badminton team has won gold medal in team event in Commonwealth Games.
Okay.
Till that time, we
Right.
were getting silver medals twice. 2010 silver medal, 2014 silver medal. But this was the first time when Indian team has got gold medal in the team event. So which was actually really encouraging, or best performance, what you can say, by the Indian badminton team as of
In
now.
fact, you have been associated with some of the star players, I would say, Saina Nehwal and,
Yes,
Kadambi Shrikant, and of course now PV Sindhu and the likes.
yes,
So, what has been your experience about, treating, not only treating, maybe, managing these elite players?
yes.
What was the role of physiotherapy as such, or your role?
Because I mean, initially when I've started with the badminton team, so I was the physio,
Hmm.
but actually the situation demanded where I had to gain knowledge on fitness also. So I had to be almost like a fitness trainer. Gopichand sir
Mhm.
was also there, me and Gopichand sir, we used to take the fitness sessions also. I mean,
Mhm.
what happens is this badminton is an individual sport. Every player want to be perfect. The difference between team event versus individual event, team event, yeah, maybe one or two players perform brilliantly on a day, team might pull through, or else team might take the win. But individual events, it's something like every player should try to be their best on that day.
Hmm.
Otherwise it's their match, they cannot win the match sort of thing. So that's something which you have realized, where it's almost like, even though badminton team, we travel as a team and we train as a team, but it's also the individual or else personal thing which we concentrate on. So that made us really take care of players individually for each and everything. So initially started with physio. So after a few months, we realized that just being a physio is not sufficient. Need to gain knowledge on fitness also. So was again into the fitness. Now we are very happy that the Indian badminton team, or else even all of us working at Gopichand Academy, there's a system where there are almost like 7 physios, 6 fitness trainers, 2 masseurs, and a psychologist and a nutritionist. But initially, if we go back to 2009, it was just 2 people. One, Gopichand sir used to be the main person, so I used to be there with this one. So that has really pushed me, challenging me to gain areas in non-physio, to gain knowledge in non-physio areas, like gain
I
knowledge.
think like a coach. I think you also had to think like a coach
Yes, ma'am.
who pushes people towards fitness.
Yes, ma'am. Pushes in the fitness, and also once we got the fitness, have some idea, and then having some what you say, we got the fitness, then the next challenge was nutrition.
Mhm.
As we gain experience, we slowly try to realize that there are different areas which might improve. Say nutrition might not. I mean, for some players who are already disciplined, it's okay. Otherwise, it could be 10% difference.
Hmm.
People with better nutrition habits, they could be 10% of their, they could be 10% better than their
Better.
usual, and that 10% is different at the international. At the international level, I would say
Exactly.
even 5% is all would also make a lot of difference like that.
Exactly.
So that's how we came to slowly one area after the other. I used to gain knowledge, and then after nutrition, the next thing was like again the mental part actually. But that part
Hmm.
I've never involved into that, because Gopi Chand sir, he's really master in the mental aspect of dealing with the player, psychological and mental aspect with that one. So I used to, whenever he used to take lectures in that one, I've gained the knowledge, but I've not so much interfered in that one. But
Hmm.
that made me have some idea on the mental aspect, which I would be sharing with the physios also, because it's like,
Hmm.
I mean, it's like what you say, a player playing a match is as equal as physio treating a player. That is their match, this is our match, considering in this way. Because it's like, what I would
Exactly.
say is like, if a normal under 15 player comes, how
Hmm.
would you think while treating? I mean, if you're not under 15, a senior player who is what you say, not a very famous, ordinary player comes, versus if a world class player comes to you,
Hmm.
what happens is even we would also have some pressure or tension, because they, like as you say, player playing a normal match versus players playing an Olympic final,
Exactly.
definitely they would be different. So that is, it's almost like what you say, normal, what you say, the mentally stronger person, something, what I would say is someone, irrespective of the circumstances, we apply our knowledge.
I
It
think that's
cannot be.
how even the Indian cricket team has evolved. I think the sports psychology
Yes,
has worked wonders in many teams,
yes,
and including apna Indian cricket team, the badminton, of course,
yeah,
with Gopichand sir. And in
yeah,
fact, badminton became such a popular sport in India because these names started coming up, of us entering or breaking the barrier and, entering the spaces where we had never been before. That's so suddenly there was this popularity which grew. In fact, I think this photograph that we see here is proof enough. There was a Indian Premier Badminton League,
yes,
right, which started, much before football became the Premier League, in India.
yes,
So I guess that's an achievement again. After
yes,
cricket, it was badminton, which has kind of broken grounds to have league teams, and we had these international players coming over to Indian teams and playing as a. So this experience also must have been very, very different.
yes, no, because badminton, it's a bit like, I mean, the funny part with badminton is everyone plays badminton for
Mm,
fitness, but the thing is like, I mean, earlier it used to be like what is a family sport earlier, which means play
exactly.
badminton for fun. If you can see, when I keep on asking many people used to say, yes, I've been playing since childhood, but it was almost more like fun and fitness part.
Mm,
The current thing was fun, fitness, and professional badminton has
mm,
also come into. And obviously, any sport results would automatically take the sport into the next level, either in terms of popularity or else
mm.
in terms of gaining a earning or livelihood through the profession like that. Because what happens is, yes, it's not only badminton, any sport, once the player reaches or else to international level, and one whenever sport becomes popular, the entire ecosystem gets benefited. Like physios would also get some jobs, and also what you say, the fitness trainers would get some jobs,
Right.
nutritionists, psychologists, and coaches, and everything. So that's how actually when something becomes popular, it's just not couple of people, but the entire ecosystem gets benefited out of that one. Yeah.
In fact, I would like you to ask. I mean, of course, this Indian Premier League, and here we see you with Marine actually.
Yes, yes.
And she is again one of those star players who, I don't know, mentally very strong. I mean, I've seen her playing the Olympics, and we have seen her losing so many sets, and we almost felt that Sindhu was going to take the gold.
Yeah.
And she literally comes out from like from the ashes, and comes out and wins the game. So
Yes.
it was heartbreaking for us, but at the same time I appreciate her as a player who has kind of. So were you also associated through the Premier Badminton League and
Yes.
training her or treating
Yeah.
her in some way?
Because Carolina Marin, I mean, I Premium Badminton League from 2016 till 2020. I worked for Hyderabad Hunters.
Hmm.
So for 2 years, she was the captain of our team. She was with
Oh,
the Hyderabad team. And this
okay.
was in 2017-18 season when she was the captain, when the team became champions of the league.
Okay, the league. Yeah.
That's a good thing, man, because with this international level and all those things, we keep on traveling, and because of the leagues getting associated, what happens is we try to know the strongest points, how they have become or why they have become so strong.
Hmm.
Because what happens is they're a bit different. I mean, whenever they are in the normal life, they are almost like us, thinking like regular people. But whenever they go to the sports, or else whenever they play, they just go to the next level mentally.
Hmm.
Physical aspect would be there, no doubt about that one, but physically and mentally also they just go to the next level. And I strongly feel even Sindhu and Saina Nehwal and Kidambi Srikanth and all these people, yes, they've also reached that one. Otherwise, beyond certain stage, just the skill is not enough. Fitness is also very important. And when we go to the world top 10 level, just skill and fitness is not just important, but even the typical mental aspect is also
Hmm.
important. So that's something which you have taken from all this. Even Carolina Marin, yeah, happy to be associated. This is, I think, Srikanth Kidambi. He was on this, I guess, was in 2017 when he won the Australian Open, I guess. So
Yeah.
he was
In
that.
fact, he was plagued with injuries, I think, post London Olympics, I think. And you again have uh, been credited for helping him come up as a player. So what was the journey like, from that to this?
Yeah, because it's like I guess he got shin stress fracture.
Hmm.
It was at the distal end of tibia stress fracture. But I mean, as I've said, the individual physios working in with the individual in individual sports, I would say it's a bit slightly different from physios working with the team event. Because in individual event, what happens is we physios working is a bit different, but players would be putting us on our toes all the time, because
Hmm.
players, they know that they can win a match only if they are 100% perfect on a day.
Hmm.
So usually that actually really what you say, that that really pushes, I'll not say pushes us, that really motivates us for us also to give at least 100% or more than 100% while dealing with the players. And the
Hmm.
best advantage with Srikanth Kidambi is he's mentally so calm actually.
Hmm.
Very, very tough situation also, he'll behave as if he's like, yeah, I'm just playing a practice match sort of thing. And
Okay.
with Saina
Okay.
Nehwal and PV Sindhu and with all
Oh,
those,
yeah.
like they will be
You
pushing.
actually come to know the stress, that
Yes,
they are under. You can feel it
yes, stress
across
and
the
also
screen.
different ways. All
Yeah.
players want to win the match, but different ways to win.
Oh,
Like
yeah.
some
True.
players would try to be over aggressive, and that's how they can, as you have said, like Carolina Marin, it's PVs in all this, they try to be over aggressive, 10% more aggressive than the regular, and then win. But some players are there who would be like during the crucial stage, they would be 20% calmer.
Hmm.
Just let me be silent, just do my
Hmm.
job, let's see whatever things happen, like that. So that's
Hmm.
how we have learned about all these different players, man. Yeah.
Yeah. So these are just, I'm sharing some of the photographs of, I guess, various events which have kind of happened. And tell us your experience in training Sindhu. I think she's come as a 13-year-old into the academy.
Yes, yes, ma'am. Yeah, almost. Yeah, since she was 12-year-old, we were with her actually. But we
Hmm.
would say Sindhu was something who is like her if we look at her career was like from here to straight away uphill actually. It was
Mm-hmm.
most of the players' carear would be like incline, what you
The
say, 45
slope.
degrees
Yeah. So
degree
not a very steep slope.
graph sort of thing. But Sindhu's, it was like, I guess, 2016 Rio Olympics, as you all know.
Yeah.
It
Yeah.
was almost like from here where her career was, it was just at the best level. And the best thing with Sindhu, what I've seen was that she enjoys, even during the crucial stages, she enjoys actually. Somehow she enjoys fun while giving her best. I mean, what happens is during sports, everyone should try to be. I mean, what I would say, I would try to what you say connect sports with studies actually. See, we
Mm-hmm.
all know that if we need to get good marks in the exams, we need to study hard. I would say if you want to be the best in the class, I would say not just 60% sort of thing. If you want to be best in the class, we need to work hard. But working hard with happiness, wholeheartedly working hard versus working hard because of some pressure or some force, both are a bit different. So that's
Exactly.
something I've seen with PV Sindhu. She really works hard and she enjoys having pleasure actually. So that was something which I've really learned from her. I've seen from her actually. But all these, as you have said, all these players we have been seeing since they were very juniors. So we had good interaction with them. And the good thing is, the best thing with even all these players is that even when they go to the world's best level, still they give equal importance to all the physios and coaches whom they have interacted, whom they have been associated with since the childhood. So that makes our job more satisfying. One is the results and then staying associated, but more is again players giving you equal respect, even if when they reach the world top level compared to when they are at what you say the normal level. Even when they reach top level, giving us equal importance, that really makes a job satisfying. Beyond certain stage, I feel like job satisfaction is also more important than other things. Like earning and results are definitely important, but job satisfaction is something which I was really enjoying with this in this badminton thing.
So, how often did you have to deal with injuries when you're this thing? I mean, do you deal with elite players? Are there many injuries, or it's more to do with improving their strength or taking it to a next level, improving the proprioception, including newer set ways of kind of doing the same exercise so that they don't get bored?
Yes. I mean, usually that's what I mean. As I've said earlier, initially I was physio for the. I joined as physio for the badminton team, and then I was almost forced to gain knowledge on the fitness part also, because finally we have realized that those who are physically fit would have less injuries. So that made me think that yes, if I want to be a successful physio, I should also have good knowledge on the fitness aspect.
Exactly.
The mental aspect is not related to injuries, it's related to performance. So when we talk about player, we are talking about two things: player, associating with player as from performance point of view, associating with players from injuries and physical aspect point of view. So it's like, yeah, different things. The best thing is that, so as we are with this in the individual sport, usually it's not the common program. Maybe I would say 60 or 70% common program, but 30 to 40% individualized program, it also keeps happening. And as I've said, now we have 7 physios working with the badminton team or else in the Gopchand Academy. So the best thing is there is much good chance for all of us to take care of players individually. So
Exactly.
usually we keep on having these assessments, individual assessments, and trying to know the weaker aspects of their injury aspects or weaker aspects, and trying to do in that way. So it has become a system now where it's not dependent on one person. The entire system is going on in a much better way, or else in a much more professional way than how it was 10 years back, sort of thing.
And what change do you see this 10 years back? I mean, how would you kind of say that the sports rehab per se has kind of changed? I mean, you must have seen it throughout the journey, maybe from 2005 to now.
Yes.
So, what changes do you see in the Indian sports rehab this thing now? Of course, with the advent of more opening up, we have access to a lot of things. And
Yes.
in case, I guess, bigger corporate people coming into sport training, like I think the Gold Quest, if I'm not mistaken.
Yes.
All right. So it's basically we are having the technology coming to us. We are having financial support coming to us.
Yes.
So I guess sports rehab per se, or the role of sports physiotherapist, in the
Yes.
whole sports scene in India
Yeah.
is changing.
Yeah, because I mean, One thing what I would say is any profession, if it needs to go to the next level, research is very, very important.
Mm,
Otherwise, what happens is if new researches are not happening, we are gaining the knowledge, only the existing knowledge.
mm,
That's the area where what I would say physio profession has really evolved in the last few years.
mm,
And I guess I would say when I used to do my undergraduation,
mm,
the research methodology was not there in the undergraduation.
mm.
Nowadays, even interns, the BPT undergraduation interns are also doing some research methodology. So
Exactly.
that's what I mean, I always feel Indians, the knowledge wise or skill wise, we are the brilliant, but we need to have, it's almost like the door is there, but the door is closed. We need to have the key. Once we can open, once we get the key, or once we open, we are very good enough to open the door and explore the whole world, sort of thing.
Exactly.
So that's something which I mean, it's not only the physio world. I mean, maybe I'm not exaggerating physio part. You can even see all these scientists working in NASA's or else even in US or UK,
Exactly.
whatever it is. All the doctors now, whoever are many of the people, whoever are helping or is researching in Corona, current situation and everything. All these are like many of the Indians are associated, which means one is facilities and second is having a way of exploring or else opening up their knowledge, sort of thing. In the
Exactly.
last few years, that's something which I have seen researchers are really picking up in India in the physio field also. And once researchers start thinking new, I mean, trying to think in a newer way also starts, because otherwise we are just reading the books and we are just following the books. And as we have seen, suppose if I'm reading a book, that book was published 5 years back, which
Exactly.
means any knowledge I'm gaining is 5-year-old knowledge. But the
Exactly.
extra knowledge or new knowledge will come only if we try to explore new aspects. That's something which I would say. And the best thing is even in sports, not only in sports, I could see many of the universities and even the government sectors also encouraging research in the physio field. That's also helping. Even earlier it used to be just one or two universities trying to do new researches, but now we can see all the universities trying to, what you say, encourage research in the physio field. That has
In
really,
fact, yeah, we have been very lucky to be associated with the Sancheti Institute.
yes, yes,
So our chairman, Dr. Parag Sancheti, is very, very research oriented.
yes,
So we have a very full and wholehearted support coming to us from the management as well as from our chairman about getting into research. In fact, he says don't take just one topic, take two topics.
yeah, yeah,
We are pushed into the research, and our students are pushed or kind of are led into research by telling them look at the opportunities, we are ready to support you, go ahead and do what research you can. So yeah, very happy to be associated with such an institute. From coming back, I think we are kind of coming towards the fag end of our interview. I think I didn't even come to know how 1 hour has passed by.
yeah.
So what advice would you give to young therapists who are looking to going into sports rehab?
Into yeah, uh,
So
yeah.
you had your journey where you were very focused that, okay, you did kind of go a little bit into neuro, but you knew you wanted to go to, work for a couple of years, go to university somewhere in Australia, do sports there, come back to India, so you were kind of, but there are many people out there who at the end of their graduation or something are kind of very unsure about whether I should take this, whether I should take that, so how would you advise them to go ahead?
I mean, generally, what I would say is, I mean, I would say something which has worked for me.
Hmm.
And what worked for me is try to select the field in which you can spend for the next 30, 40 years of your profession. Because once you take a profession, for example, once you have decided I will be a neurophysio, or else I will be a pediatric physio, or else I would be a sports physio. Once you have decided and once you have elected the field, remember you need to be in the field at least for 40 years. And generally, I would not say few people, physios whoever have finished their undergraduation, generally sometimes some would be asking the question like, if I take which field, I would get more opportunities to settle.
Hmm.
Usually what I would say is, if settling in any field is so easy, that field would get saturated in couple of years.
Hmm.
So there is nothing like easy field. And at the same time, there is nothing like really difficult field if you are really thorough about the knowledge. So what I say is, I mean, this is one of the great words I keep on hearing. In any profession, the topmost opportunities are still vacant. We need to be good enough to catch the topmost opportunities. The lowermost opportunities would be there for anyone. But any field, because I would again give the example of sports. There would be some team which is world number one. But if you defeat them, you can be world number one. So there is nothing like copyrighted to anyone. It's just like the topmost area of any field is always vacant. It's just that are we good enough, and are we knowledgeable enough, and are we hardworking enough to occupy that one? No one can stay. The topmost area is not copyrighted to anyone. So I would always say smart work and hard work, knowledge work, and smart work. All these, if I can say, would take you to that one. So if you select any field in the physio, is it something which, whichever field you select, just try to recollect, is that something which I could really push? Or else which would drive me to get to the next level, not just staying with the knowledge after finishing the post graduation, but still, is that something which would really encourage me or give me fun to gain knowledge to go to the next level? And we have seen this earlier. We are, at least in this interview, we are talking about neuro physio, or this, what you say, sports physio. But you can see now in this current COVID situation, the cardiopulmonary physios have got the maximum importance.
Exactly. I was just going to ask you, in fact, how has sports rehab changed in the current pandemic situation? Because,
Yes, yes. Yeah. And
how did you all manage during this pandemic?
One good thing is that's what, since that time, during last year, I guess from March 15th onwards, the sports were, the government has received around March 15th to 20th, government has guided us to stop the sports activities. But we have realized that, yes, that is something, this pandemic is something which would stay for long time. It's not going to stop in few weeks' time. So we have started with the online classes at that time.
That's what you said, yeah.
Yes, online classes.
Which includes all the training.
Yes, and I would say I am in constant touch with at least 3 or 4 cardiopulmonary physios to give me good advice about understanding the, what you say, the pandemic thing. Because we can also say that, I can say I'm in sports physio, but definitely I would say whoever is dealing with the COVID patients is much more better experienced than me, and is in a much better situation to advise them. Because even for us also, even though we are sports players and everything, all would be asking us questions about, and we have also seen even couple of players getting affected with the COVID, few mild to moderate cases, couple of players had severe cases. And at that time, I would really say these cardiopulmonary physios, I should really thank them for giving
They
me.
have been the heroes, I think, of the
Yes.
pandemic, very recently. Not from, I'm hearing stories since past 1 year. In
Yes.
fact, I've guided the other therapists also about how to go about with, dealing with patients.
Yes, yes,
Or when they are admitted, or how to avoid what breathing exercise post COVID, what is supposed to be done, and even when they were admitted with very serious conditions in the ICU, how to deal with it. So I guess we have learned a lot from the cardiopulmonary. As you said, the importance of each, this thing keeps changing. So get into something where your heart is set, and you'll
yes.
do good there. So
And with
that's
this
the basic.
COVID thing also, even the community-based physio also would be something which should be
Exactly.
really emerging in the next few years. It's not just one of these things. So
Exactly.
areas of physios which were not highlighted till now. And you can say even this community-based, what's the cardiopulmonary physios, what I would say is, I guess recently we have read articles where just by coming to the proning positions, we could
Yes.
increase the oxygen percentage by almost 10%. From 85%, oxygen percentage has increased to 90 to 93%. All these are nothing but all these are paramedical success of paramedical physios getting into the researches and showing that we could do with our knowledge, just by physio knowledge itself, how can we go to that one? So that's
Exactly.
something which I would really hats off to all the physios working in the COVID situation, cardiopulmonary physios, and who all are helping in the field.
Anyway, so yeah, coming back, I guess this photo sums it all. I think this is Dr. Kiran getting the Distinguished Alumni Award from Manipal University. I guess this is a 2008 kind of a picture, if I'm not mistaken.
2008.
Yes. So yeah, so I guess that sums up the whole the feeling that everyone has about an Indian physio who's made his mark, not only in his own this thing, but also around the world. I guess you known as an NDS instructor, and you are known as the physiotherapist to the Indian badminton team, which has made its mark in the world. So I guess all in all, we are very proud of your achievements, and we were very happy to have you as our first interviewee in the road less traveled. And I hope everyone has gained a lot from this, whatever sir has told, whatever Dr. Kiran has talked about, his journey, as well as whatever he talks about, how they have changed their entire outlook during the pandemic, and also about how things go on and what you should be doing. I guess just put your heart into it, and whatever your heart says, just do your hard work and dedication. And I guess nothing is unachievable, nothing is impossible. I guess that's that.
And
So thanks a lot, Dr.
yes,
Kiran, and I really hope you achieve much more successes with the Indian badminton team, and here's to much more success to the badminton team also. I mean, I hope they qualify for the Olympics, and we see another silver, gold, and many more medals coming our way.
and
So thanks a lot, and I
for,
guess we'll wind up this interview.
yeah, for those
uh,
who are hearing the interview, Sona ma'am, whoever have done the interview now, she was actually our teacher during our undergraduation.
yeah,
Actually,
I purposely didn't mention it because I didn't want to.
yes, when I was studying in Manipal during undergraduation, usually I would say I still remember five names: Sona ma'am, Swati ma'am, Rajni ma'am, Arun Maya sir, Preet sir. So we used to wait for the. Usually they used to take classes only for third year and fourth year BPTs.
Exactly.
Maybe
Yeah.
one or two classes in a year for second year just to motivate. Mostly in the exercise physiology part actually. So we still used to wait for Sona ma'am, Swati ma'am, Rajni ma'am, Arun Maya sir, Preet sir, and Bharati Ballare ma'am for us to take
Yes.
the classes. We really used to wait for them. And I should also really thank, because what happens is, see, teaching is different, but motivating you as a person during the profession is different. So that's something which I've learned from all my teachers actually. Because what I would say is, it's like parents give you birth, but teachers give you professional birth actually. So that's what I would always say. Teachers, I mean, whenever we achieve something, always try to remember teachers, I mean, parents, teachers, and people who have given you opportunities. I should also thank Sona ma'am also. At that time, we really used to wait for ma'am's classes and when would the classes come. It's hardly used to be 2 or 3 classes in a year, remember. We still used to wait for all these six associate professors and professors at that time to wait for the classes. So it's really great,
Yes.
Sona ma'am, taking interview. And thanks a
Yeah,
lot.
thanks. Yeah, I am also very proud. I mean, when I went through their whole list of achievements, I'm like, oh my God, I'm really proud of Kiran having done all this. So
Thank
yeah, Kiran, it was really nice, even as a ex-teacher, to be kind of interviewing a student. And yeah, I remember the golden Manipal days very often, and we are still, all of us are still in touch, and we still reminisce on those days. And you students, I mean, we remember all of you all also. So many of them are kind of this thing on the Facebook also, friends, but I'm not a regular with social media. But anyways, it was all in all a very, very enjoyable experience talking to you and knowing your whole journey, which has been very, very inspiring. So yeah, we'll end the interview now. I guess we are already running short of time, and we have gone past our 1 hour. So yeah, many more accolades to you, and I'll always feel proud to be associated in some little way in your training somewhere in your undergrad period.
you. And
So
all
bye for now. Yes.
your
So
community.
bye to everyone listening to this interview. And we will surely meet again with one more interview with a very eminent physiotherapist very soon. Till then, bye bye. Take care and follow your heart. Yeah. Bye, Kiran.